All right, so we're gonna talk about 4 self-assisted cough techniques. We're gonna go from the easiest, like the most functionally impaired will be able to do this, to the hardest, which involves quadruped. But before we do the self-assisted cough techniques, I'm gonna review the stages of the cough with you.
Okay.
And I want you to carry through the stages in each of the positions.
Okay.
So the 4 phases of the cough are being able to breathe in, hold it, come forward into a flexed position, and then 2 strong coughs. And I'm sick, so this is gonna work really great for me. Sorry. So I'm gonna go ahead and try that. Breathe in, hold it, come forward, and cough. 2 coughs. Very good. And I know it's really weird to fake a cough, but you did a great job. Okay. Now, if we want to facilitate a deeper breath in, you can cue your patient to bring their shoulder blades back as they breathe in, or look at the ceiling, or bring their arms up over their head. So why don't you try all 3 of those, where you take a deep breath in, but you bring your arms up and your shoulder blades back, and then you hold, come forward, and cough. Okay? So deep breath in. One more time. Let's go. Deep breath in. Hold. Come forward and strong cough. Oh, that was very good. You're a champ. You can work on just prolonging the hold process, because some people have trouble with breath control. So you could just work on breathing in and then holding, and seeing how long they can hold their breath for, because controlling that breath before the cough is really important for the cough. So those are a couple ways to kind of facilitate that. What I do with kids is sometimes I have them blow bubbles or blow a balloon and try to keep the balloon in the air. Like I'll toss the balloon, makes them bring their air in, control it so they can blow it out. So those are actually really good breath control exercises. Mm-hmm. But we're gonna go through the 4 different self-assisted cough positions first. So I'm gonna have you lay on your stomach, up on your elbows. Yeah. So just lay on your stomach and then prop yourself on your elbows. Oh, you can keep your head up and you can bring your elbows kind of more like this.
Okay.
And you can keep your head up. Okay. Yeah, so that like you were watching TV on your stomach or something like that, okay? So this is for somebody who doesn't have the trunk control to maintain sitting on the side of the bed. Maybe they've had a stroke, maybe they have ALS, maybe they have MS. They either can have a family member help them get into this position, or if they can get themselves into this position, certain spinal cord injured patients can roll themselves into this position, but can't necessarily hold themselves on the side of the bed. So from this position, you're gonna do the same 4 phases of the cough. So you're gonna breathe in, hold it, come forward, and cough. And we'll have a base in there to collect any mucus that comes up. Okay, bring it in, hold it, don't blow it out, and now come forward and cough. Very good. Okay. So the next one I'm going to have you do is called the long sit. Yes. So now the patient is sitting at a 45-degree angle, and her arms are out behind her and her legs are straight in front. So this is the long sitting position. And what we're going to do from here is we're going to have you do the same 4 phases of the cough. So this is again for somebody who's too weak to hold themselves on the side of a bed, but strong enough to get off the bed, because when we get off the bed, we're able to ventilate across the entire chest wall instead of having the back up against the mat. So this is like the next stage up. So if somebody was having trouble with this, I would go down to prone on elbows. If somebody was doing fine on prone on elbows, I would try this. If they can do this, this is the better option because it creates more ventilation, but not everybody's strong enough to do this. So from this position, you're gonna tilt your head back, take a deep breath in, hold it, come forward, and 2 strong coughs. And then of course we would hold a basin to try and collect any mucus she was able to bring up. All right. The next one is going to be a short sit self-assisted cough technique. So you can come over and sit on this side. So this is for any patient who can sit on the side. Sometimes we have the patients hug a pillow especially if they've had surgery or have pain. Sternotomy or abdominal surgeries can be very painful to cough. So in this case, I'm gonna let her hold the pillow. And this is very similar to what we were doing earlier when we introduced the 4 phases of the cough. She's just going to take a deep breath in, tilt her head back, hold it, hug the pillow, come forward and cough. Great. Now, is there any reason you can't do this in a wheelchair? No, you can absolutely do it in a chair or a different surface. If someone can't hold themselves in sitting or long sitting, but can hold themselves in the chair, that's great. You just want to make sure that if they bring themselves forward to cough, they have enough trunk control to stop themselves from falling all the way forward. So the first time you did this in a wheelchair, you'd want to guard them. Make sure they don't throw themselves out of the chair doing the cough technique. Any questions so far?
No.
Okay. So now I'm going to have you in quadruped, which means on all fours. This is the last one we're going to do together. Your shoes. All right, so turn around and get on all fours. Okay, and then for this one, it's like almost like a full body movement. So you can do it statically, where from this position, you can arch your back, bring your head up, deep breath in and hold, and then come forward and cough. And when you cough, you want to arch your back. So you're going from an arched back to an cat back. I don't know what to call it, right? They're both arched, but you're going from arch this way to arch this way. So let's try it one more time. Breathe in and arch your back, and then come forward and cough. You're going to bring your hips up when you come forward to cough. So this time we're going to create a little more movement in it. So the patient, again, right, is on all fours, on her knees and her hands. She's got her head up. She's going to drop her stomach and bring her head up to hold the air in. And then she's going to arch her back and bring her head down to do the cough. Okay, and you can even create a little more movement with this, where you come up, arch your back, and then when you come back, I want you to go like into child's pose. So come back to cough. Yeah, and you can even put a little bit more movement into it. I'm gonna try that one more time. Arch, and then tuck your stomach in and bring your head down and cough. So that's the hands on knees rocking technique.